and welcome to Health Matters. I'm Dr. Mark Castellaw with Baptist Medical Group. Okay, everyone, summer break is over, and now that the kids have settled into another school year, it's time to turn your attention to your family's health. Have you gotten your yearly checkup yet? Are you ready to get your vaccination? And don't forget, your kids need to get their vaccinations too. And if your children are going to play sports this year, they'll need to get an additional sports physical. What exam should you and your kids get this fall? What vaccination should you get? And when? A team of experts and I will answer these questions and more on this month's episode of Health Matters. So grab your organizer and your pen or your smartphone, and we're prepared to give you some valuable information because your health matters. The regular annual physical has changed a lot over the years. You can now get them at your doctor's office or even an urgent care center. Some say you don't even need an annual physical, but we don't agree with that. Baptist Medical Group internal medicine physician Dr. Alison Pomykala is here to discuss this issue with us today. Welcome, Dr. Pomykala. I know her real well. I raised her. She's been with me since the beginning. Now, what is an annual physical? When people say, have you had your annual physical, what really is that?
Well, there are three main benefits we have when people come in for an annual physical. Number one, a goal is prevention and to maintain wellness. And one of the things we do is we try to detect diseases before they become a problem. And then we also manage people's chronic health problems in order to prevent future complications. And we do recommend that patients come in yearly to touch base, review their health history and their family history, and get appropriate screenings and blood work.
You know, a lot of people take better care of their car than they do their body. They'll go get the car oil changed and tires rotated, but they won't go get a checkup. So when you come in for an annual physical, they're coming in to see you, what are some of the things that you're really looking for?
Well, when our patients come in, first we start by taking a great health history, find out anything that is running in their family, what sort of chronic health problems they might have, any medications they take. We do a very thorough exam, and we do a laboratory evaluation, some blood work to screen for things like cholesterol and diabetes, age-appropriate cancer screenings. In women, we recommend cervical cancer screening with pap smears. And we also recommend bone densities. Once you get to the age of 50, in general, we start recommending colonoscopy screening, which is colon cancer screening in both men and women. And then for men, we do prostate cancer screening as part of the blood test as well. In addition to our cancer screenings, the other major chronic health problem we have in the United States is cardiovascular disease, and so we really take a close look at cardiovascular risk factors, what runs in patients' families, screen for appropriate blood work, and then discuss with patients the potential of doing a stress test or a heart calcium score to detect early heart disease before we have a major health problem.
Yeah, you mentioned about colonoscopies. What are some of the things that you look for? What are some of the criteria to have a colonoscopy?
Well, colonoscopies are usually started in both men and women at age 50, even if you are feeling fine and you have no family history and no symptoms. If you have a relative, a first-degree relative in your family that has colon cancer, then we recommend that you start 10 years prior to the youngest person in your family diagnosed with this disease.
Now, one of the biggest concerns that patients have is, will my insurance cover this or not? How are the insurances and Medicare dealing with annual physicals?
Usually most private insurances now are covering an annual physical. We are seeing better coverage and more awareness in the role of prevention to try to detect these diseases early before we run into some serious consequences. So generally they are well covered.
Well, as you said, which is so important, the annual physical is really a prevention where you're trying to find things before they turn into something serious.
Exactly.
Now, what about counseling people about diet and exercise? Is that part of all this?
It is, and that's one reason to maintain a relationship with your primary care physician and come to see them yearly. You know, in addition to some of these screenings we talked about, your internist and primary care physician could be a great resource for you. There's so much information out right now on the internet. A lot of patients really would like some direction on what is the appropriate diet, exercise strategy that would be best for them, to answer questions on various things they have read online or heard from friends. And so you can really be a partner with your patients to design a prevention and wellness strategy that's most appropriate for them.
And what Dr. Pomykala said just now is golden. To have a relationship with your primary care doctor, because as she said, there's so much stuff out there, you don't know what to believe. But you got to have somebody that's a quarterback or a guide, and that's exactly what we're here to do, right?
Absolutely. I get asked daily about various diet programs, exercise programs, books that are online or things that are on television, and a lot of patients have read the information, but they're concerned if it is safe for them to begin a regimen such as these, or if it's even effective at all.
Well, trust your doctor, not Dr. Google. Thank you so much for being here today. Do you know which health screenings you should be getting? Next, an internist breaks down which health tests that you need. So stay with us on Health Matters.